Lacey Weller. I have my doctorate in nursing, so I'm a family nurse practitioner, and I work here in Charlton, family practice. So I see newborn babies all the way up to 103 is my oldest patient.
Wow, that's awesome.
She's cute.
Oh, I can imagine.
Yeah.
So what exactly does a NP do?
So a family nurse practitioner sees the gamut, so we see little ones, we see adults, we see families here, we see people for their physicals, we also see people for sick visits. In addition to managing their care, we can diagnose them, we can prescribe medication, and see them for follow-up.
Okay. And so can you explain the difference between, you said you're a DNP, so what's the difference between that and then just having a regular, standard NP credentials?
Yeah. So my schooling is a little bit different. So I went to Union College and I got a degree in neuroscience and Spanish. And then I went back to school and I got another bachelor's in nursing. And then I got my master's in nursing, so that's the nurse practitioner piece. So as a master's prepared nurse, you can be a nurse practitioner and practice in New York State. And then after that, I completed my doctorate. So it's basically a terminal degree, so it's similar to a PhD, but it's clinical based. So that doesn't really change what I can do in practice. So I'm still able to do just the same amount of people with just a nurse practitioner degree. But I'd be able to teach, in a college setting if I wanted to, and it just helps to keep me on par with other terminal degrees like MDs or PharmDs. So this is basically like the highest degree you can get as a nurse.
And, in your opinion, what personality traits do you think makes a really good NP?
Well, I think you have to be extremely patient. You have to kind of have a tough skin. Unfortunately, you're seeing patients when they're not feeling well. So think about when you're not feeling well, you're not probably the friendliest person in the world. So you have to be able to navigate with the patient going through a hard time, for them and their family. So I think you have to be able to communicate with all people, from all walks of life. You have to be able to enjoy discussing hard topics in a sensitive way. But at the end of the day, you just have to remember what you're there for, and really it's for them. And if you're not there for the patient, then eventually you're going to have to find a different career, because most of the time, most days are rewarding, but the most days are hard, so you have to balance that between your own life and caring for the people that are in your practice. So I think that's probably the most important thing, is just remembering why you're there.
Would you say that it was easy for you to find a job once you had your degree and passed your exam?
I would say it's a little bit difficult to get your first job. So like any entry-level job, a lot of employers are looking for experience, so I found it more difficult for friends of mine that weren't working as nurses before they applied. So some people decide to go to nursing school and then they go right to their nurse practitioner degree. So they go to school full time, and fortunate for them, they don't have to work, so their experience is quite limited, whereas in my case, I worked full-time and I went to school full-time. So I was working as a nurse for the 2 years I was getting my master's. So I think that helped me get a job, because I was able to, go through scenarios with my employer, like, do you have this patient? What would you do in this scenario? And I had some life experience. So I think that helped me, as opposed to being an entry-level nurse practitioner with no medical experience, behind me. So if you're able to work a side job, work as a nursing aide or, a CNA, patient care coordinator at the hospital, something like that, or in the medical field in general. Some of my colleagues were like pharmacy techs or home health aides or something like that. That will help you, for sure. And then I think my other degrees also helped me just in terms of job placement and interviewing and those kind of skills that they don't teach you in nursing school.